wouldn't be able to get back into my own house. But in all seriousness, one message is not a single peer-reviewed paper that would pass government muster or investigator analysis to support the outcomes of spinal fusion surgery. Second take-home message is just a quick piece of what it was like being a patient. Basically, it was horrible. So I was a patient in my own hospital. I picked the doctor who had, I thought, the best possible bedside manner, who had a great regional reputation. There was no published information about his actual outcome. I was reduced just like any other patient. You know, when you're in that examining room, getting evaluated preoperatively, thinking about what I had to do. So there you are in that examining room, you know, ambient temperature, 55 degrees Fahrenheit. You got that silly gown on. Your rear end is on that ridiculous tissue paper. My wife was with me because I know from the literature that when you're in that setting as the patient, your IQ drops 50 points. And that could have been a real problem. So Esther was taking notes. When Todd Albert put my MRI up on the view box in the office, took one look at the MRI, started sort of smirking, I knew I was in trouble. And then I don't remember a damn thing he said after that. So it was good that Esther was there to take notes. Finally, post-op morning 1. So this is a big procedure, 4 screws, something you don't really ever want to have. 10 weeks out of work, returning to work with a back brace and a cane, but pain-free. So post-op morning 1, I'm in my own hospital, 9th floor of our university hospital. I'm feeling no pain. You know, I'm on a morphine drip. Life is wonderful. I have those compression stockings on. I'm not sure what end is up, but I do remember one really important issue on that first post-op day when the orthopedic team, and I use that term loosely, the orthopedic team comes in to change a 12-hour-old dressing. And I got packing on, you know, this thick and that deep. So they said, you know, roll over, we want to take a look and we got to change your dressing. So I'm like, okay, whatever. I'm on that morphine drip after all. Everything is fine. But I see out of the corner of my eye a blur. And that blur was Mrs. Dr. Nash, who had been sleeping on a cot next to my hospital bed. Now, she only weighs 90 pounds, not even 5 feet tall. All our children are midgets. You'll see a picture later. So the blur, you could probably figure out what the blur was, right? It was Esther, who had used the cot as a trampoline, had projected herself over my bed, and had tackled the orthopedic team who had come to see me as they were preparing to change a 12-hour-old dressing. What little detail had they left out 8 years ago, you know, in the prehistoric era? Of course, no one had stopped to wash his hands. This was despite the fact that my daughters at the time had put a big poster with glitter on my hospital door that said, "All those who enter here, wash your damn hands." Well, there's a lot more about this hospitalization, aspects of which we can't tell in mixed company. But the main message is no evidence. So trust in the provider, like any other patient, and all kinds of issues in terms of the process of care itself. Well, in Pennsylvania, we're a national leader, in case you don't remember. This is the first ever report of its kind in the world, never duplicated anyplace. 6 years ago. This report, of course, not on spinal fusion, but hip and knee replacement surgery, lists every orthopedist in Pennsylvania by name and their outcome with regard to hip and knee replacement surgery. So complication rate, unexpected return to the operating room, mortality, average cost, and all the rest. So this is a harbinger of where we're going under reform, and I want to give you 4 words to think about, so when we're done this afternoon, you'll remember that. I'll say it a couple of times. So first, it's all about transparency and accountability. And I know that Spectrum, you're working pretty hard on that, from your Vision 2020 to your work with Prometheus, as difficult as it might be. I know that you support the agenda for transparency and accountability. That's a given. Where I think we're going to be going, and we'll come back to this at the conclusion, is a world characterized by the following. No outcome, no income. Let me give that to you one more time. No outcome, no income. That's what the Affordability Care Act means to me. And by the way, I've read all 2,700 pages. It took an entire weekend. Incredibly deadly reading. But a lot of stuff packed in there. So much stuff make your head spin. But this is just the beginning of this tidal wave of accountability and transparency. And I know you've been working with this pretty well. But I think way more is coming down the road that we may not really be sort of grappling with. Individual ambulatory physician scorecards as an example of where we're going to be by 2014 and 2015. But back to Pennsylvania, a pretty amazing report. What do you think this report shows? Is there any difference among the doctors in our great Commonwealth? Well, you bet. So another 3 words to remember is what? Unexplained clinical variation. So it's good that the doors are closed and we're all in here kind of together. No members of the laity are walking by. Because in our great Commonwealth, there are physicians at Jefferson University Hospital doing 150 hips per doctor per year. And then in the western tier part of our state, there are docs doing 12 a year. That's 1 a month. So just imagine the teamwork at the hospital doing 1 a month. Where's that thing again? Oh, well, we had it last month. Whereas the team doing 150 a year, and we could talk about what's all that about, and patient selection criteria, appropriate utilization. We have a lot of issues just on that alone. But this report shows unbelievable variation in outcome, volume, time in the operating room, mortality, that's right, mortality, across our great state. We have a lot of work to do before we're really ready to talk about the Affordable Care Act, taking on risk, being fully accountable for what it is we do every day. We'll come back to that theme. So here's the best definition, All hospitals are accountable to the public for their degree of success. If this initiative is not taken by you and me, it will be taken by the lay public. Well, outstanding. So I could have put in the lower right October 1st, 2010, and we all would have sort of nodded, okay, cool. But this really comes from the incorporating documents of the American College of Surgeons from their meeting at the Waldorf Astoria Hotel on Park Avenue in Midtown Manhattan during World War I. And here we are, 90-plus years later. It's amazing that today's October 1st, and we're dealing, I would say, with many of the same issues. So another challenge, I think, is how are Jefferson and Spectrum, how are we going to deal with this 1918 issue? Who's responsible? If we're not going to be accountable, how will the system promote this? And we'll come back to that theme as well. Okay. Well, another tough thing to think about is 2 covers. This is a Business Week magazine a couple of years ago, and you could read the subtitle, Medical Guesswork from Heart Surgery to Prostate Care. The medical industry knows little about what really works. Wow. What's that all about? And how do you like this cover? Spin that doctor on the roulette wheel and see where he ends up. Yoga, chiropractic, you get the idea. Kind of a very disquieting cover. What's it all about? And why is it on the cover of Business Week magazine? So you and I know our little secret that about 18% of what we do at the bedside, in the hospital, in the office, on average, 18% is based on solid, grade A, randomized, controlled trial evidence. The other 80+% is what you and I know and respect and love and have devoted our life to, which is the art of medicine. Because we're not building cars, we're not building widgets, we're taking care of people. But the evidentiary basis on which we're making these decisions is weak. The people who pay the bills for what we do, the readers of Business Week magazine, well, to some extent, they're on to us. Now, everywhere but Spectrum and Jefferson, this is a problem. In the rest of the country, this issue of unexplained clinical variation is going to be our downfall if we can't figure out a way to work together to figure out which rate is right and which resource combination is the right one. So big problem number one, 18% of what we do is based on solid science. The rest is the art. The problem is the people who pay the bills are not connoisseurs of great art. And that's a huge challenge for us. If you don't like Business Week, here's Time Magazine, our doctors just playing hunches. And here's, of course, the scientific evidence. 5 papers in the New England Journal in the last 5 years alone by Elizabeth McGlynn and her team. You know this, right? Half of what we do, we get it right half the time. So taking all comers, from breast cancer to hip fracture, based on retrospective chart review published in the best journals we've got by some of the best teams in the business, we could quibble about the details, but this is a disquieting, aggravating message that I'm giving you, especially following John Stossel and Mike Abrahamshoff. So what's the issue? The issue is everywhere but Spectrum and Jefferson, the rest of the country, we get it right half the time. We're 17% of the GDP. Well, that tells me you don't have to have an MBA from Wharton to figure out if we get it right half the time, we're spending all this money, we're not getting a lot of value for the dollars that we're spending. And value is all over your Vision 2020. That's all in there in your mission and value statement. So this is sort of the beginning of the challenge that we face. And it's not just Spectrum and Jefferson, of course, but our whole squirrely non-system. So there are some other issues here. Let's skip this one in the interest of time. So here are the people who care about the last 15